Welcome to The Summary, a podcast from Mary Freebed, where we explore physical medicine and rehabilitation, one topic at a time. Together, we will gain insights, discover innovations, and deep dive into the latest developments in the field.
Hi, everyone. Welcome to The Summary. I'm your host, Dr. Yunna Sinskey. Today, I'm excited to welcome two guests to talk about all things AI documentation in the clinical setting. Joining me today is my colleague, Dr. Johnathan VandenBerg, a specialist in the care of adults with spinal cord injuries and medically complex condition. Dr. VandenBerg, thank you for coming on the podcast.
Thanks so much for having me.
I'm thrilled to also welcome Dr. Dean Dalili, Chief Medical Officer at DeepScribe. Dean brings over 20 years of experience in healthcare, from being a hospitalist to industry leader. At DeepScribe, Dr. Dalili and his team are focused on making medical documentation smarter, so doctors like you can spend more time with their patients.
Hi, Yunna. Thank you for having me. And Johnathan, good to see you.
Good to see you as well.
Thanks so much.
All right, let's get started. So I think, Dr. VandenBerg, it was a few weeks ago when we were at the hospital potluck party where you made one for some excellent chili cook-off. But I
took 6.
It was really great. And I remember kind of sideline complaining to you about oh my gosh, I have so much documentation still left and I can never really finish it during my work hours. So it's always spilling over to my, after work time. And that's kind of when you told me about your AI journey with DeepScribe. Would you be okay kind of sharing your story with us?
Sure. So I've always been interested in tech, and I was kind of a nerdy kid building my own computers when I was younger. I have cousins who work in machine learning and have always had an interest in machine learning, but something to help me with my documentation because I love engaging my patients. I love looking them in the eye and being able to have a conversation about their health without worrying too much about treating my computer. And so about 2 years ago now, it seems, I started using DeepScribe with conversations with our partner Covenant Health, who was using it primarily for primary care. And we were one of the first subspecialties to get involved in DeepScribe and utilizing it for different varieties of visits than primary care visits. So I deal with very medically complex patients, and oftentimes multiple medical issues come up during our sometimes hour-long visits. I can tell you the first time I started using DeepScribe, it was a huge relief anytime I would see it start or when it was recording. It just took a huge burden off remembering everything that happened in that conversation, and it made a much more comprehensive note than I would have documented previously. I will say the transformation over the past 2 years that I've been using it has been remarkable. It's learned how to make things more concise, more accurate, and really helped me more and more the more I use it. So my entrance into AI has really been over the past couple of years, starting with kind of ChatGPT and using that, but then using an actual kind of certified medical AI scribe has been remarkable.
Are you mostly using it in the inpatient setting or the outpatient setting, you would say?
It's pretty much all outpatient right now. I will occasionally hit record for inpatient encounters, and that can be helpful, but I oftentimes will not blow that into my note just because I prefer some of the formatting that I currently use.
I think one of the biggest question I had was how do you do the physical exam? Because that's something that I struggle with. I always I remember intern year when you're seeing 10 patients in a row back to back in the morning rounds. I just could not remember. I had to go back to the patient's room so many times because I couldn't remember the physical exam. How do you work with that, or does DeepScribe help with that?
Yeah, DeepScribe can help with that. I tend to use my own template, and I think that is an area for potential improvement, and maybe Dean, you can speak to that a little bit more, how they intend to help with that more. The problem I have with it is you have to verbalize your entire physical exam, and oftentimes a lot of physical exam is observation, and so saying it out loud can be a bit awkward. Um, and I find it easier just to fill in my own kind of templates to put down my thoughts.
Dean, Dr. Dalili, what are some other ways that the team has been using it? What are like some feedbacks you've been getting?
Yeah, Yunna, and you can call me Dean. Yeah, I would say number one, thank you for having me. We have a variety of providers across multiple different subspecialties who use DeepScribe, and it's interesting to hear Jonathan's story of noticing the changes in the product that's happened over the course of the last 2 years since he's been a user. I've been with the company for 6 months, and one of the things I've been really impressed with, it's my first time working for a clinical software company, is just the speed and the rigor with which our team is constantly making updates and improvements based upon user feedback and things that we're learning about different clinical settings and different types of information that we're trying to capture. I would say the vast majority of users are using DeepScribe in an ambulatory care setting today. We do have functionality in the emergency room with small scale pilots for new functionality that we're developing, and a plan in 2025 to grow into the inpatient world, where we'll have much more integration with EHRs. I understand your system is on Epic, and so Epic integrations are really key to enabling a lot of the functionality of what we're trying to build. With regard to the physical exam in particular, it might be helpful for us to do a refresh on with Johnathan offline. But one of the ways that we've found is the most helpful to help people with documentation is to help them come up with a customized template that will plug in normal elements of a physical exam that they might routinely do, and then capture anything abnormal. To Jonathan's point, the software doesn't have eyes and it can't read your mind. And so if you don't say something or verbalize an abnormality, then it won't capture it. But there are ways that we can work together to try to make sure that the normal things which you normally wouldn't say in medical language are captured, and that even some of the abnormalities, if you say it in layman's language, could get into the note.
Yeah, I was actually thinking about that before this podcast. Like, yeah, I probably need to do a refresh with them for my because like for review of systems, for example, it does a nice job because I gave them the template that I typically ask during my visits, and so it's able to put yay or nay next to all the different review systems. And so I was considering that exact scenario where if I have the different muscle groups that I typically check, would I just be able to say like hip flexor, dorsiflexion, and that sort of thing, and it could plug in those numbers into a better format, because the format right now is a bit narrative and harder to follow for me, and so that's where I think the formatting can make a big difference in terms of conveying information to other providers. And I think that's something that has, again, drastically improved over the past 2 years, because it used to include so much information into an HPI that it wasn't digestible. And so now it's really made it much more concise and easy to follow, and including the really important points, which is more valuable for communication.
Hmm. So I've never used DeepScribe personally, but what I'm hearing is that you kind of create your own unique template, and then the AI will actually automatically bring it into that. Is that correct?
Yeah, I would say a couple things. Number one, we are DeepScribe. One of the things that makes us more unique than several of the other solutions that are out on the market is the ability for providers to customize their note templates. And so we call that our customization studio. And really, you should think about it in sort of three different levels. Institutions such as Covenant or Mary Free Bed could determine, based on clinical quality or compliance standards, we want to make sure these elements of the notes are present in everyone's documentation. And then below that, we could say, hey, for service lines, there's different archetypes of a note. So for orthopedics or for PM&R, we may want to do things that are musculoskeletal, much more detailed than we would do for cardiology. And so we will have archetypes of notes that are clinically specific, where different elements of histories will come through, different elements of physical exams will be emphasized. And then we could customize at the level of the individual. And so individuals can go into their customization studio and select different responses for individual exams or how they want things to be sequenced. And we just this week rolled out something called auto styling, which will automatically learn over time from edits that have historically been made to notes, and then adjust your customization so that way those edits aren't necessary into the future. It will take time for it to learn from your work, Johnathan, but it will do it, and we'll get smarter and smarter the more you use the product.
That sounds super cool. It's like truly AI in some sense, really. Yeah. How does it kind of work? Do you like walk in with an iPad? Is there a speaker on the ceiling? Like, how does the program itself work? And how does it make it HIPAA compliant? And do I have to ask the patients for any consent? Like, I have like so many questions.
Yeah, so let me just kind of give you a rundown of the technology. So the technology is an app. It's currently in mobile devices on iOS, which is Apple's operating system. And so 86% of people have an Apple device, and they could use it right on their phone. You can use it on a tablet. You could use it on any Apple device, a touch. You can also use it on a desktop if you have a Windows. If you have an Android, you can't use it through Android. You could use it through a desktop as well. And so the software sits in that app. You basically just click a button. The app is integrated into your EHR, and so it will sync with a schedule for an ambulatory setting. And if you have patient cancellations or late additions, that schedule is dynamic. And so you just click on the person's name, you hit scribe it, and then what happens functionally is that the software is listening. So it leverages the iPhone's microphone, which is probably the best microphone in the business, better than the microphone that I'm sitting in front of. And then it listens to the conversation. As soon as you're done and you hit recording, then you could hit scribe it. It will take that audio recording and then transcribe it into a text. And then through natural language processing and through the AI, will then perform summarization. And all this is happening within 45 seconds to a minute after the recording ends. And then the note, which is produced, is automatically integrated into your EHR. So most users will go into the EHR to make changes or any cleanup edits that they need to make. But the software is 100% HIPAA secure. We have to get certification, including SOC 2 certification, to determine that we are HIPAA secure and that we can control patient information in a secure fashion. So safety, security are obviously really important to us at DeepScribe. Making sure we have single sign-on authentication. With regard to patient consent, every state has their laws related to two-party consent. And my understanding of Michigan is that it's a one-party consent state. And so you may not need to, I'm not a lawyer though. And so you should refer to best practices there. But we always encourage people to obtain consent from a patient before they record the visit. But in some states, it's not necessary.
Dr. Vandenberg, in your experience, how much time do you think it has truncated in your clinical documentation, and how much time do you actually use editing?
Yeah. So oftentimes when I come into the room, I do ask the patient for consent just to add on to that. And there's a attestation thing at the bottom of my plan that says I used AI DeepScribe for this. And I think that can just be helpful. And I think the patients actually take a lot of comfort from it too. They're like, oh, this iPad's actually including my thoughts into the documentation, and isn't necessarily selecting it, even though I do go in and edit it after it's in the EHR. In terms of time, it saves me time for sure. So I feel like there's kind of two types of doctors. There's doctors who finish their note like during the visit, and then there's doctors who don't. And I was the latter. And I would oftentimes go home, have pajama time, and be finishing my note at 10 p.m. and the following days to try and get things done because as I said, I like to engage the person and really really connect with them. I think that's an important part of a doctor-patient relationship to gain trust. And so having this listen and be able to basically dictate my thoughts and put it all down on paper in a very fast way saves me probably close to an hour a day for clinic. And so that is getting me home in time for dinner. That is saving me pajama time. And I think doing it accurately. So for me, there's been a lot of advantages to having it. I wish there was an inpatient tool that I could use as seamlessly. I think there's going to be a lot of integration challenges because of the way the inpatient rounds flow, and incorporating history, I think, can be one of the more challenging aspects of this because it doesn't necessarily pull from the chart. It just pulls from the audio. From my understanding. And so I saw a recent article about in Taiwan, they have a AI scribing technology that pulls from multiple different databases. We have a lot of regulation in the U.S., and so it probably wouldn't be feasible for a machine learning to go into multiple different EHRs or a patient's entire medical record to pull that sort of data into your note. But it can create like a medical summary for you. And so oftentimes what I do before going in is I'll basically dictate to DeepScribe kind of my past note in terms to give it a little bit of context about what we're talking about. And oftentimes similar to primary care, I consider myself almost primary care for spinal cord injuries. So I cover a lot of the common issues like high blood pressure, like bowel and bladder function, spasticity and mood, and psychology. So yeah, overall, it's comprehensive. It saves me time, and yeah, I like it.
Yeah. I was actually so curious about the subject of how much documentation time we're using. And I found out that, of course, it depends on specialties, but it's about 30 to 50% of your clinical time you're actually spent, like all of us are spending on medical documentation. And I feel like because physiatry is such a like overarching like functionality of the entire human being, instead of just like focusing on very specific topics, inevitably our our conversation with our patients are going to be longer. Our notes are going to be much longer, and we're just going to spend that much time. And I think that's one thing that if you're not in the medical field, you're kind of surprised to learn that, oh my gosh, they're in front of the computer more than they're in front of the patient, which is
And I will give you some harder data. When Covenant and myself were exploring this, the people who wrote notes late and were kind of chronic late note writers had more time savings than the people who kind of finished their note during the visit. But the people that finished their note during the visit still saved time. There is a little bit of a learning curve. Like the first few months that I was using it, I would say I was probably spending more time double checking it and making sure that it was accurate just to kind of gain that trust. And now I think with the more concise format, it has shifted to saving more significant time. But
Dr. Dalili, what's the kind of the research and feedback that you've been getting so far with all the users of DeepScribe?
Yeah, I would say it really resonates with me. Jonathan's perspective. I would say the most tangible thing we see is that people do save time, and it's usually on order of magnitude of about an hour per day, sometimes up to an hour and a half, and that can have a real meaningful impact in your clinic life, in your home life. Um, you know, you ask me sometimes like, well, what's the most surprising feedback you've gotten from someone? Actually, not from a provider, but from a spouse who wrote us thank you letters saying, hey, now my wife gets home in time, and my husband's home in time, and the kids see them more, and they're at events more frequently. And so just hearing from people that there's meaningful parts of their day and of their life that this has helped them with. Obviously, from a professional perspective, is really satisfying to me. I'd say the other perspective that we see is that patients get more engagement out of the visit. So we work with Ochsner, another large multi hospital health system based in my home state of Louisiana. And their patient satisfaction scores went up 8% to the upper 90s for providers who are using DeepScribe. And what we attribute that to is that providers now, instead of having their face buried in the computer screen, can now turn and look at the patients, look at the family members. They don't feel the time pressure or the cognitive load of trying to sort of hone in on only specific data elements. They can really just let the conversation be free flowing and let the microphone do the work for them. And then I'd say the third thing that we've noticed is that a lot of specialists tend to filter the conversation and the documentation around the chief complaint or the diagnosis for which they are seeing a patient. And what Ambient does is it lets the other comorbidities kind of get reflected into the documentation and ultimately into billing. So for oncology, we work with one of the largest private oncology practices in America. We saw their non-oncologic diagnoses go up 34%, which translated into higher billing codes. Now, this was care that they were doing already, but then they would turn to the computer after a 45-minute visit and only document, the sort of primary diagnosis that they were engaging with for a patient. And so there's just so many things that I expected people to save time. I expected doctors to be happy. But I did not necessarily expect that the patients were going to be happier, that the care would be more comprehensive, that the financial benefits would be so compelling. And so, that's been a real insight and learning experience for me too.
Just to piggyback off that, our billers, I've asked them like, "Hey, how are my DeepScribe notes?" And they're like, "They're good." so, so yeah, I think it definitely helps, and that's the more comprehensive documentation. It talks about all the education that I did. It talks about our game plan for medication titrations, so I don't have to go back and type it all in. It Yeah, it gives specifics, and that's helpful.
How does it work? Does it like act when you're does it bring up the billing code? Does it bring up like all the diagnoses associated, or is it just like in the note itself?
Yeah, so we don't currently suggest codes for billing. It is on our roadmap to do that. Really, what it's doing is it's listening to the conversation and it's inferring diagnoses. So if you and I were to talk about, high blood sugars and insulin, the AI would know that we're talking about diabetes. And to Jonathan's point, we actually have recently deployed context awareness so that now the AI can look at previous notes and see what diagnosis codes patients have, and in some cases pull that information in. Because if you have a high level of complexity in terms of your previous visits, you don't want to recreate the wheel every time you see a patient. And so for many of the chronic specialties, we're beginning to use more and more context awareness notes, where once a diagnosis is established, you could rewrite the new note in the context of having read previous ones. And so, we're just figuring out new and better ways to, again, I think, hone in on how we make the process more effective. I would say in the first iteration of the company, and Jonathan even precedes this, it was just a goal to see like how quickly could we turn around the same sort of work product and save people time. And now I think what we're trying to do is really try to move the bar and say, how do we write a better note than the doctor might have written before? And that's where picking up new diagnosis codes and trying to really be succinct and hone in on medically relevant information is, sort of the current area of focus. And then as we think ahead to where this can go, how do we identify care gaps within the chart that the provider might need to close? How can we figure out, more specific billing terminology or coding terminology so that the provider can get full credit for the work that they're trying to do? In a value-based care world, what are some of the high value therapies from a cost perspective or from a quality perspective, that you could use or that you could make decisions around and try to nudge people in terms of, taking better care of patients in the future. We haven't really, we've only, I think, begun to scratch the surface in terms of what's really capable as we really think through the partnership between AI and providers.
And yeah, Dean, I guess just for my history, I didn't look back at my emails exactly when I started using DeepScribe. But yeah, curious when that was. I think it was about 2 years ago. I think it was at the beginning of 2023, but yeah, it's escaping me. But
Is there any like data of we kind of touched upon patient satisfaction and then financial and billing and then saving time as a physician. Is there any data in like patient outcome with using DeepScribe?
I'm not familiar with any. We haven't really looked at that from a quality perspective. I would say we're not really intentionally trying to drive, clinical decisions at this point, or even guide them. I think that's an area where we want to go. And so for the time being, I'd say the biggest impacts have been time savings, burnout reduction, productivity improvement, volume, slight volume increases for providers. There you get all of this time per day, and I would say it's roughly a third of people who will go home earlier. It's a third of people who will extend their careers because they feel like they can work longer, into what would have otherwise been, burnout or forced retirement. And then a third of people will say, hey, I'd actually like to see more people, because I'm getting through these patients faster. And so I wouldn't. I'm not aware of of any data either within DeepScribe or externally that's really looking at hard outcomes at this point.
so I was also curious about potentially performing tasks like orders or things like that too. I think that sort of integration could be really beneficial, along with like saying writing a work note, or giving you a template for a work note based on certain diagnoses or what you discuss.
Yeah, I mean, great idea because it's things that we think about now. I mean, what are all of the different downstream workflows that we could derive from the patient conversation? And if you're talking about changes to medication regimens or labs you're going to order or images you're going to order, that could feed into notes. Right now, the limit there is the ability to create that order through a draft, due to an API, with Epic or the EHR that you're using it within. But the technology exists. And so it's just a question of trying to get the connection so that we can benefit the maximum yield, from the time that you spend with the patients. And patient summaries, education, notes, referrals, those are all things that we think are ways that we're going to be able to have more and more time savings downstream.
Yeah, I definitely like to ditto that on like the work notes and the school notes for our little kids too. Yeah, that would be really amazing. I know, Dr. Vandenberg, earlier you kind of alluded on the learning curve in the very beginning. How difficult was it? And then, Dean, if you could also comment on like, are there any specific programs to help the providers use it? And then even like ongoing like kind of tune-ups, anything like that too?
Yeah, I guess I'll let Dean go first because I mean, I was one of the kind of first users, I think, probably. So it's been a while.
Yeah, so our well, we call it our customer success team. It has really grown a lot since Jonathan started using the software. And for large enterprise customers like Covenant, which is the license umbrella that he falls under, we actually are now re-engaging them around expansion of DeepScribe. And so when we get into these areas of growth, we end up sending people from our team, our customer success team, out to clinic areas where providers are learning the software and trying to get established. We usually precede that with some remote, educational materials. We have videos that you can watch that are like 2 to 3 minutes long that give you a sense of how the software works and the functionality. And then we also have remote support where you can engage someone virtually, and then have them help you make changes to the customization studio. But our on-site support team will typically follow someone into clinic, say, here, use this device, press go. And then when they come out, most providers don't love their note the first time they use it. And so then the CS person will make some edits to their customization studio based on that feedback. And then they hand it back to them and say, here, now go try it again. And then people are like, oh, yeah, that's much better. And so we can really accelerate that onboarding experience when we have in-person assistance. Obviously, that's not scalable to every single user in America. So we try to do some of that virtually, and remotely, whenever possible. But I think the best experiences when you have someone at the elbows. And that's what we try to do for a lot of our large customers.
Yeah, I was very lucky. I had a great customer service experience during when I was starting. They brought a few people out, I think, to go over my template that I used for clinic and then customize the DeepScribe for my template and basically make a note for me that I could integrate into the EHR. And I don't know if they were just buttering me up or what, but they were like, your note is very structured. It's going to work perfect for DeepScribe, and so I think having that structure can help influence how DeepScribe works for you. But the learning curve was, as I said, probably a couple months of trying to get used to it. But overall, it with the I think another part that's changed a lot is the processing time. There was a human element before, and there's no longer a human element, and so the turnover time is within like 4 minutes after I press scribe. And so it's a much quicker turnover. I used to have to wait like 30 minutes to an hour sometimes to get that scribe back, and then again I'm doing it after work or something. So that processing time I think changed over back in last January or something, and it's been remarkable change. Now I have dot phrases for each section of the note, and I just plug it into kind of my known template, and it works pretty quickly. And then when you edit that smart phrase that you can put in there, you can just edit it manually in Epic. So it would be interesting to see how DeepScribe is being able to pull that feedback into its software so that it can learn from its mistakes. But yeah, now it's kind of a normal part of my clinic where I walk into the patient room, I press record, I say, hey, I'm using DeepScribe. It's this AI scribing technology. It saves me time. Thank you. And then we get started. And then at the end of the visit, I'll after I've run through the entire conversation, it actually I think has helped me with my communication to the patient say, this is what we're doing today. These are your different diagnoses, and this is the plan. And that really helps DeepScribe, I think, incorporate that into the note and make it more clear. And so it probably has changed the way I communicate because I'm thinking like, oh, I'm dictating right now, versus just kind of having that conversation and, oh, I'm going to dictate later. So
Yeah, that's interesting because like you're training the AI system, but at the same time, the AI system is like training you as well. So it's kind of like a feedback thing going on there. Yeah. So, what are some things that you would really like to see being added into? Let's say you have like a magic wand, and this is like programmer God kind of like coming down and saying, hey, I can give you anything you want. What would it be for you?
so I think the things that I feel like I've given up are the formatting a little bit. I would oftentimes label things as certain diagnosis with under HPI or date them and have a chronicity to the story. And I think I've lost a little bit of that. However, the ability to capture the comprehensive nature of the visit, I think makes up for that. And so that's why I still use it, right? Um, I think with what Dean mentioned earlier, formatting the DeepScribe template and having it pick up certain fields um, where you can be a little bit more specific in terms of the diagnosis would be helpful, and kind of having a refresh, just like you said, on my template and how that could be incorporated would be really interesting. I think the assessment and plan right now, it tends to be a bit disorganized because it's not by diagnosis. And so trying to have the diagnostic categories and then which orders or which plans go under each of those. And again, that may be just incorporating more of a template.
Yeah, and we actually have all that functionality. And so Jonathan, we'll sync up after the podcast, and we'll get you squared away because I think we could solve a lot of those problems for you today.
Sounds like you need a tune up. It's and then lastly, I kind of wanted to ask you, you're the only provider that is currently using DeepScribe at Mary Free Bed. How did that conversation go, and how were you able to convince the hospital to use this program?
So I was lucky, I'll say. I was on a outpatient advisory board with Covenant, and I was the only Mary Free Bed doc who was on that board. And so I volunteered. I was like, yeah, I would use that for sure. They had 25 licenses over at Covenant, and then they gave Mary Free Bed one, and so I was that fortunate.
I want to be the second one, just FYI. Dean, what about you? Are there any other ways that we could kind of like data to bring or anything like strategies to convince our network of people to kind of use more of it?
Yeah, I mean, I would obviously I have a conflict of interest. I'd love for you all to have access to it and and figure out ways that we could expand the software. I mean, look, I would say the most important thing I've learned in the last 7 or 8 months since joining the company is that some health systems bought a limited number of licenses to this, thinking that this was mostly a burnout tool to help people who would self-select as being the ones who needed help. And that if they made it available to, let's say 10%, 20% of the people who most demanded it, then that would be sufficient. And I would say what we've learned in that time period is that now the software is getting so much better and so much more advanced, saving so much time, capturing so many more diagnoses that, yeah, you will make providers happier, but there's a much broader group of providers who could use this technology and benefit from it. And so, I think, the putting my business hat on and taking off the doctor hat, I'd say the terminology and the statistic that real decision makers at executive level use is like, what's the ROI? What's the return on the investment? And so if the investment that you're making of the cost of the software is just to make people happy, it's hard to see what the return is from a financial perspective. But if what the return is that you're seeing more patients, you're capturing more diagnosis codes, you're making, you're capturing more essential elements of the documentation, you're driving up patient satisfaction, then you can justify bigger investments and more licenses at an enterprise level. So those would be the things that I would suggest that doctors talk about if they're trying to sit in those rooms and change behaviors.
Yeah, and I think identifying that this is really the future, right? I mean, we in medicine oftentimes are the last ones to adopt change, uh, and so I feel like looking to the future and incorporating technology is such an important aspect of today's society, and we need to be forward thinking on this. And part of the reason why I volunteered is because I'm a tech kid, right? I like dealing with technology. But even for the older generation who doesn't like change and has done things for the same way for the past 20 to 30 years, if you give them easy accessibility to converting their talk to text in a meaningful way, they are going to be on board and, as he said, extend their careers and increase the time they're with the organization.
Yeah, absolutely. Totally agree that it is the future and that is how it's going to be. I kind of assume that this is going to be part of every hospital system like 10, 20 years later, and that'll be the standard of care.
Faster than that.
5 years. How about that? All right. Well, thank you so much, Dr. Vandenberg and Dr. Dalili, for your time and like thoughtful insight. We really appreciate it.
Thank you so much for having us. And Johnathan, thank you for, just giving folks a little bit of insight into what it's like and what the journey that you've been on with our product. And so, yeah, great to be here and great to see you both.
Yeah, it's my pleasure, and it's really nice meeting you and hearing the story of the company and seeing it evolve over time has been fantastic. And seeing significant improvements and changes you guys are making, I think is going to be really advantageous for the entire field.
And to our listeners, thank you so much for listening. We definitely like to hear more from you guys. I'm assuming it's like below right here on the comments section. Share your stories about how you use AI, medical documentation technology, your struggles, your wins, all your thought process. So right here below.
This has been The Summary, a podcast brought to you by Mary Free Bed, hosted by Dr. Yunna Sinskey. Like, comment, and subscribe wherever you get your podcasts.